Alright, so hi, my name's Amber Johnson. So my video today is going to be about the effects of nutrition on multiple sclerosis. So I think before we get into the different supplements, it's important to kind of understand what multiple sclerosis is. So, the research article that I was drawing from for this slide is a research article written by Trifonos et al. Entitled Dietary Supplements on Controlling Multiple Sclerosis, Symptoms and Relapse, Current Clinical Evidence and Future Perspectives. And so they're in paragraph 1, and I've noted it here on my concept map. It gives you a very basic definition of what multiple sclerosis is. So multiple sclerosis is a chronic, progressive, demyelinating disease, which negatively affects the central nervous system. So the way it was always described to me is to think about a phone charger, right? So a phone charger has this protective coverings. So we know there are wires in here, right? So if I were to take a knife, cut this open, and expose the wires, my phone charger would probably still work, but it'd be spotty. I'd probably have to finagle it to get it to work. The connection would be really bad. It probably fails. And if you see there, here is our nerve. So we have our purple nerve, and then we have that long column, so that's our axon, which is carrying messages from the nerve cell away, perhaps stimulate a muscle, etc., etc. And then we see that yellow covering, which is our myelin sheath. So the immune cells essentially are going in and attacking that myelin sheath. Now, if you can see here, it's damaged. We see some damage, and just like that phone cord, it's damaged. So all of a sudden now, the communication is bad. And once that connection is bad, we know that muscles are very innervated, so now there's going to be issues with things like walking, numbness, weakness of the limbs, etc., etc. So if you notice here, I have a few of the symptoms of multiple sclerosis listed. Now, if we look at the other side of my concept map, I list the prevention and outlook. So the cause of multiple sclerosis, the cause of multiple sclerosis, there we go, is unknown. There is no direct correlation between multiple sclerosis and any one entity, but there are some speculated causes. So one of those causes, or those speculative causes, is geographic susceptibility. And so that ties in with the fact that typically we see in multiple sclerosis that patients are vitamin D deficient. And so there's an idea that there's some correlation between vitamin D deficiency and our geographic location, because we get a lot of vitamin D from being outside. If you're in a place that doesn't get much sun, perhaps it makes you more susceptible for multiple sclerosis. They also mentioned viral infections. We're going to talk about omega-3s and the effect that omega-3s have, but for immune cells to get into the central nervous system, that blood-brain barrier needs to break down. And so some people have speculated that viral infections may make someone more susceptible to that breakdown and weaken that blood-brain barrier. So that again could be another cause, viral infections. So let's look at omega-3s and how that affects multiple sclerosis. So again, I'm referencing that article I just mentioned, written by Trifonos et al. In 2018. So omega-3s are important because they help with brain function. If we look at our concept map under omega-3s, the next line says, deficiency has been considered to increase susceptibility to damage of myelin. And that's, again, pulled from Trifonos et al. There in paragraph 9, influencing the metalloproteinase 9 production. So this is a really important group of proteins, and we're looking at actually number 9. So what they found is that by putting study participants on a limited diet and giving them a supplementation of omega-3s, that they had a reduction in the immune cell secretion of MMP-9 by 58% after 3 months. And so that MMP-9 is really important. It's thought to be a major player in immunopathogenesis, It's also thought to orchestrate the breakdown or the disruption of the blood-brain barrier to recruit inflammatory cells into the central nervous system. And so it's essentially, like, I was thinking of it as this like orchestrator. It seems to be sort of it seems to be helping to activate more of those immune cells. It's also you know, by and large, then helping to facilitate some of that degeneration of myelin. So if we can decrease the secretion of MMP-9, the idea or the thinking is then that there's less immune cell activity, less myelin breakdown, and overall just good for the nerve cells. So kind of a big deal. Okay, so next we're going to talk a bit about biotin. So the next article that I looked at was an article written by Heidegger et al. In 2016 that looked at the effects of biotin and iron on progressive forms of multiple sclerosis. So I'm going to focus a little bit more on the biotin side of things. But biotin, if you notice here, I have kind of two blurbs here. Biotin is a big deal when it comes to energy metabolism. So one of the telltale signs of multiple sclerosis is fatigue, and a really simple way of saying, or I'm sorry, to explain the cause of fatigue is to say that, things are misfiring in the brain, so it's requiring more energy. And so that's really what Heidegger's article draws attention to. They postulate the theory that the loss of myelin along the axon changes sodium channel distribution, leading to increased energy demands. So what was done was biotin was supplemented to participants over a period of time, and they were observed at different times in the study. So at 9 months, 24 months, they were assessed to see how they were doing. They were assessed to see the speed of their walking. So they were asked to walk 25 feet, and then they were timed. They were also assessed on their level of disability. And so what was found was that the treated population had a improvement in either their walking or the disability scale. 15.5% of them had that result. Right, so now that we talked about the role that these studies found on multiple sclerosis when adding in these high dose levels of biotin, I think it's interesting to talk about why does it matter in relation to multiple sclerosis. So if you look back at my energy boost blurb on my concept map, I talk a bit about the role that biotin plays in sort of combating that fatigue and helping with energy. So for one, like I said before, biotin is big with the carboxylation of pyruvate to form oxaloacetate, which is a big deal with citric acid cycle. And so that helps things like the oligodendrocytes that I mentioned here, that are very metabolically active, and they support that citric acid cycle within the cell to help it be able to create myelin. And because the myelin sheath is damaged, remember on that axon, there's fewer sodium channel distribution, and we know that that is really important when we're talking about things like depolarization and repolarization of the cell. So because there's damage there, the sodium channel distribution is irregular, and then the cell has to work harder to restore that resting membrane potential, and they're trying to sort of make up for these areas of demyelination. So now we have issues with the cell now having to have an increased energy demand to keep up with the necessary requirements to maintain equilibrium. The like we said, the sodium channels are not abundant as they once were, and so now there can be an imbalance with that calcium 2+ that's being released. And then that can also be a major player in fatigue, but also a major player in issues with things like walking and muscle contraction, that of course is important if we're talking about, maintaining mobility. So all work together. And so biotin sort of serves to bridge the gap. Hopefully look into more research and to bigger studies, bigger populations of studies. The hope is that there will be more promising information coming forward about the relationship between biotin and multiple sclerosis. I also have a blurb here about the CoQ10. CoQ10 was also another supplement that's mentioned in the Trifonos et al. Article, where they saw that it also helped with depression and fatigue. And also we see that MMP-9 come up again. It was also helping to reduce the secretion of that inflammatory marker. To talk briefly about my references there and my citations, let me get my head out of the way, and thank you for your time.